Did you know there's one simple step that over 70% of seniors overlook when choosing their healthcare plan? A step that could save you thousands of dollars and countless headaches. Stick with me, because by the end of this video, you'll know exactly what it is. Hello and welcome. If you're approaching your senior years, or perhaps you're helping a loved one navigate this chapter, you know that thinking about healthcare can feel overwhelming. It's like being handed a map to a giant maze, but the map is in a different language. I've been there helping my own parents sort through the endless paperwork and confusing terms. It can be a stressful time, filled with more questions than answers, but it doesn't have to be. Today, we're going to walk through this maze together, step by step, and turn that confusion into confidence. Let's start with the big one, Medicare. Think of it as the foundation of senior healthcare in the US. It's a federal health insurance program primarily for people aged 65 or older. But here's where the first fork in the road appears. Medicare isn't just one thing. It's made up of different parts. First, you have Original Medicare, which includes Part A and Part B. Part A is often called hospital insurance. It helps cover inpatient care in a hospital, skilled nursing facility care, hospice care, and home health care. For most people who have worked and paid Medicare taxes for at least 10 years, Part A is premium-free. Think of it as the roof over your head when you're seriously ill. Then there's Part B, which is medical insurance. This covers your day-to-day healthcare needs, things like doctor's visits, outpatient care, medical supplies, and preventive services like flu shots and cancer screenings. Unlike Part A, most people pay a monthly premium for Part B. Together, Part A and Part B are your basic toolkit for healthcare coverage. But, and this is a big but, Original Medicare doesn't cover everything. It doesn't typically cover prescription drugs, dental, vision, or hearing aids. That's a huge gap, right? This is where many people get tripped up. They enroll in Original Medicare and assume they're fully covered, only to face surprise bills later. To fill these gaps, you have two main paths. The first path is to stick with Original Medicare, Parts A and B, and add on a Part D plan for prescription drug coverage. You might also add a Medicare Supplement Insurance Plan, also known as Medigap. A Medigap policy is sold by private companies and can help pay some of the remaining healthcare costs that Original Medicare doesn't cover, like your deductibles, co-payments, and co-insurance. It acts as a safety net, catching those extra costs. The second path is to choose a Medicare Advantage plan, also known as Part C. This is an all-in-one alternative to Original Medicare. These plans are offered by private insurance companies approved by Medicare. They bundle your Part A, Part B, and usually Part D prescription drug coverage all into one plan. Many Medicare Advantage plans also offer extra benefits that Original Medicare doesn't cover, like vision, hearing, and dental services. This can sound incredibly appealing, everything in one neat package. So, which path is right for you? This is the most critical decision you'll make. There's no single best answer. It depends entirely on your personal situation. Let's talk about how to choose. First, think about your health. Do you have chronic conditions that require frequent doctor visits or specific medications? If so, you'll want to check if your doctors are in the network of the Medicare Advantage plan you're considering. With Original Medicare, you can generally go to any doctor or hospital in the US that accepts Medicare. Advantage plans, however, usually have a network of doctors and hospitals, and going out of network can be costly or not covered at all. Next, consider your finances. A Medicare Advantage plan might have a low or even $0 monthly premium, which looks very attractive, but you need to look closer. Check the deductibles, co-payments, and the annual out-of-pocket maximum. This maximum is the most you'll have to pay for covered services in a plan year. It's a crucial safety feature. On the other hand, combining Original Medicare with a Medigap policy might mean a higher monthly premium, but it could result in more predictable and lower out-of-pocket costs when you actually use your healthcare. It's a trade-off between paying more upfront each month for more certainty versus paying less monthly but potentially more when you need care. Then there's your lifestyle. Do you travel a lot within the US? If so, Original Medicare plus a Medigap plan might be better, as it provides nationwide coverage. Many Medicare Advantage plans have regional networks, meaning your coverage might be limited when you're away from home. And don't forget prescription drugs. This is a big one. Whether you choose a standalone Part D plan or a Medicare Advantage plan with drug coverage, you must check the plan's formulary. The formulary is simply a list of the prescription drugs covered by the plan. If you take specific medications, you need to ensure they are on that list and understand what your copay will be. The official Medicare Plan Finder tool on Medicare, Gov, is an invaluable resource for this. You can input your medications and find plans in your area that cover them. Now remember that secret step I mentioned at the beginning, the one that over 70% of seniors overlook. It's the annual open enrollment period. Every year from October 15th to December 7th, you have the opportunity to review and change your Medicare coverage. So many people just stick with the plan they have year after year out of habit. But insurance plans change. Your health needs change. The plan that was perfect for you last year might not be the best one for you this year. A plan's network of doctors could shrink, or they might stop covering a medication you need. Taking just an hour or two during this period to review your options can literally save you thousands of dollars and ensure you have the best possible coverage for the year ahead. Mark those dates on your calendar. Let's hear from someone who's been through it. We spoke with Mary, a 72-year-old retired teacher. She shared, "For years I just let my plan renew automatically. I thought it was too complicated to look at anything else. I was shocked. I found a plan that covered my prescriptions with a much lower copay and included dental and vision, all for a similar monthly premium. I switched, and the peace of mind is incredible. I just wish I had done it sooner." Mary's story isn't unique. The system is complex, but there are resources to help. The State Health Insurance Assistance Program, or SHIP, offers free, unbiased counseling from trained volunteers in your local area. They aren't trying to sell you anything. Their only goal is to help you understand your options and make the best choice for you. You can find your local SHIP office by searching online. Navigating healthcare is a journey, not a destination. It's about being proactive and informed. Don't be afraid to ask questions. Call the insurance companies. Talk to a SHIP counselor. Speak with your doctor about what they recommend. Your health is your most valuable asset, and choosing the right healthcare plan is one of the most important investments you can make in your future well-being. So let's recap the key takeaways. First, understand the basic structure. Original Medicare, Parts A and B, versus Medicare Advantage, Part C. Second, evaluate your choice based on your health, finances, and lifestyle. Third, always check the prescription drug formulary. And finally, the most important tip, use the annual open enrollment period from October 15th to December 7th to review and optimize your plan every single year. This journey might seem daunting, but by taking it one step at a time, you can find a path that leads to security and peace of mind. You've worked hard your whole life. You deserve healthcare that works hard for you. Thank you so much for spending this time with me today. I hope this has helped demystify the process and empowered you to take control of your healthcare decisions. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more straightforward guides on navigating your senior years. And please share this with a friend or family member who might benefit from it. Take care, and we'll see you in the next video.